Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. A new study by researchers at Montefiore Health System found that healthcare transportation challenges are strongly associated with certain chronic health conditions. Joining us now to discuss this in detail and more is Dr. Kevin Fiori, Medical Director at the Office of Community and Population at Montefiore. Welcome, Dr. Fiori. Thank you so much for joining us today.
Thank you for having me.
Of course. So first, I'd like to learn about your role as the MD at Montefiore's Office of Community and Population. Can you tell us a little bit about that?
Sure. So I am a general pediatrician by training, and I'm also a researcher. So I work at the Office of Community and Population Health in looking at the data that we have about the communities where Montefiore works, and trying to find ways to use that data to improve the care that we provide to the Bronx community. So I specifically within the office focus on what's called social determinants of health. So things outside, where people live, work, the conditions that may shape their health. I look specifically at those factors and how Montefiore can understand how that affects the communities that we get to work with.
Thank you for that. So now we're talking about this new study,
Yes.
including on healthcare transportation. So what did Montefiore find in this study, which highlighted healthcare transportation challenges? If you can share, Doctor.
Great. It's a great question. So just I just want to make clear that the study was we weren't targeting health transportation per se. We were looking at an array of social needs that our patients answer as part of their visits at Montefiore. And so we looked at 10 different social needs. And what we found, which was quite interesting, was that health transportation tends to be mostly associated with a lot of the chronic disease conditions that our patients have. And so that was a stark finding among all the things that we ask about. We ask about food, having enough food to eat, the condition of the housing, the condition of whether you're able to pay your rent. And of all of those needs, health transportation seemed to stand out as just being a barrier. We think it's a barrier to accessing care. So it was an important finding. And we looked at over 35,000 Montefiore patients.
What were some of those chronic conditions, Doctor? If you can break that down for us.
So we looked at, I would put them into three buckets. So we looked at sort of health behaviors like smoking, alcohol abuse. We looked at chronic disease conditions like hypertension. We looked at diabetes and asthma, the sort of leading chronic conditions. And then we also looked at mental health conditions, so depression, anxiety.
Got it. Thank you for that. And those are pretty prevalent in our communities already. Diabetes is, high in our communities in the Bronx, as well as chronic heart conditions as well. No?
They are. And I think the question is, there are things that we do as a health system, as Montefiore, to help with those conditions. But there are things that affect those conditions that happen outside Montefiore's clinical walls. And so one of the big take homes from this study was, how can we as a health system working with community members and families, how can we better understand those needs? Because we know that they affect whether your asthma is well controlled. So as an example, I'm a pediatrician. I see lots of kids with chronic asthma. I can talk to families about, you need to take your controller medication every day. But if there are other things that are happening in that household that may be affecting whether they can take that medication, like, for example, we don't have enough food to eat, or we're behind on rent, or the quality of our house is just not sufficient. We have mold, we have pests. That's going to affect whether that family can actually take that medication. And it's important as care teams and providers that we understand that. Because our patients and our families and our communities deserve that.
Right. And you helped give us a name for that. It's called social determinants of health, SDOHs. Which determinants are most prevalent in our community, doctor? I know you mentioned the relationship between asthma and mold. There's also other things such as infrastructure, like highways, no, where
Yeah.
people live.
It's a big topic. And so in general, social determinants are conditions of the environment where people work, play, worship, and that affect their health. We know that. There are positive social determinants of health, like green space. There are negative social determinants of health, like poor quality of housing. I would put the poor or the adverse conditions into a social risk bucket. And then on top of that, and something that we focus on at Montefiore and Einstein is targeting what we call social needs. So that's a subset of social terms of health where the patient or the family actually says, I have this need, as opposed to, poverty in general or environmental conditions in general. So the patient is actually telling us, hey, this is something that I've identified that's affecting my family. And so at Montefiore, we were really focused on understanding not only these broad social determinants or social risks using population level data, but also on an individual perspective, what are the needs that are affecting this individual in front of me or this family in front of me?
Right. Who better than the patient to identify that, we're the experts in our lives.
You are the experts. I mean, moms and dads are experts in anything to do with their kids. And so they are a partner with us. And so that's how we have to look at this. And we want to get away also. And I think this is a really important part of the study is not making assumptions about what a community may be facing based on data that is, aggregated. It's taken from, big data sets, but may not actually reflect the individual experience of that family. And that's key. And we will only know that if we ask the family, because they're the experts, as you say, in their own experience. And they'll also be the partner in finding a solution to that problem that they've identified.
Thank you so much for that, doctor. So going back to the survey, how and when was it conducted and who were the participants in the survey?
It's a great question. So the survey was actually not intended to be a research study. So we started about 3 years ago asking patients that walk into that utilize our primary care practices to, we asked them about social needs with the goal of being able to identify these social needs and provide meaningful resources to those families or individuals. So that was happening in our health system for the past 3 years. What we did as part of this study is we just collected all of that data that already existed. In this particular study, we just focused on adults aged 18 and above. And we asked the question, are there associations between social needs that individuals are reporting and particular chronic medical conditions that they may have? And so that was sort of the nexus of this particular study.
Right. Thank you for sharing that. So as we understand, the study took place prior to the pandemic. How has the pandemic affected SDOs, which we're talking about now, social determinants of health? Would you say that these numbers could have been higher due to other present factors such as lack of employment, inability to pay rent, etc.?
Yeah, it's a fantastic question. I'm going to give you an answer that's probably not answering the question totally, which is I'm not sure. My assumption is that based on some of the unemployment rates that we've seen in Bronx County, the increase in unemployment, that has likely led to increased reporting or prevalence of social needs. It's unclear with, for example, the American Rescue Plan of 2021 and a lot of the investments that came both federally and also from the state, how much of that blunted that effect. But my concern is that, and we're not out of COVID by any means yet, but with the vaccination rates increasing, that the economic consequences of COVID are going to be with us much longer than the clinical consequences. And so I think we need to start planning now as health systems, as governments, to prepare for that we're going to see it. We're going to see these social needs in the families that come into our clinics, and we're going to have to find ways to partner with community-based organizations, with governments, with the Department of Health, in finding ways to address or mitigate these issues, because they ultimately influence the health of the patient. So Montefiore, we are taking a proactive approach in trying to understand the extent of the problem at the individual level, and finding meaningful ways to help families address those problems.
Right. And absolutely. Thank you for that. And, one of those ways is conducting surveys like this to assess these challenges before things like this happen, like COVID-19, and the pandemic exacerbates all these issues that already existed before. So I'm sure Montefiore will keep us up to date and continue to host.
We'd love to. Yeah. I think being aware of the problem is the first step. And, right. You need to ask individuals, we're very keen on not making the assumption, and asking families what they need.
Thank you so much, Dr. Fiori, for your time today. Before we go, just if you can just emphasize how Montefiore is seeking to address this transportation health challenge for its patients moving forward.
Yeah, it's a great question. So, informed by a lot of the data that we've collected so far, we've actually launched several pilot programs to explore, possible rideshare partnerships, ways to address gaps in public transportation. So these things are ongoing, and we would be happy as they develop to share sort of the results with those. Again, it's to our advantage that we have this data, so that we can target and tailor those programs to particular patients and individuals that may need them the most. And so that's what we're hyper focused on. My office is focused on moving forward. How do we use data to figure out which families and individuals need help, and how do we target and tailor those interventions around that.
We welcome you back to discuss any updates on that access. Thank you so much, Dr. Kevin Fiori, for joining us today.
Thank you.
We'll be right back here on Open BXRX Tuesday.